Good morning. Good morning. Good morning. I'm Howard Hu. I'm the Dean of the Dalalana School of Public Health, and welcome to day 2 of our Global Health Summit, Creating a Pandemic of Health. Who was here yesterday? Woohoo! Fantastic. But there's some people who weren't, and I'll like to share with you a little bit about what happened. You are all here because you represent the future of global health at the University of Toronto and with its partners. This summit has allowed us to assemble a critical mass of you, scholars, professionals, students, alumni, policymakers from a wide range of fields. Our school and its Institute for Global Health, Equity, and Innovation, which we affectionately call IGGI, is well positioned to play a pivotal role in generating the evidence and training leaders that will help create the sustainable, equitable health and health promoting systems of now and the future. Let me tell you a little bit about yesterday. Our summit's co-chairs, Rani Kotha, Abdullah Dar, Ross Upshur, Alex Haddad, prepped us on the process and thinking leading up to the summit. Then in Cluster 1, Creating and Spreading Health, Alex Haddad, our e-innovation expert, did a brilliant job explaining how and why it is critically important to move beyond simply thinking about health as simply a state of being free of disease towards a concept that embraces resilience, functionality, happiness. We can actually take advantage of new methods for measuring these new concepts of health, salutometrics, and he released the initial result of his team's salutometrics World Atlas, and then served as a talk show host, combining his inner Oprah and Jon Stewart to interview a bunch of luminaries. Marc Lalonde, the author of the 1974 Lalonde Report, the first government document that highlighted the importance of social determinants of health. Staney Brown, Kwame McKenzie, and Natalia Pace, Paula Rashan, on what it would mean for health systems, mental health, hospitals, medical students, and the Lalonde Report to think about what the Lalonde Report would look like today in a globalized 21st century. And then in Cluster 2, Julio Frank, the Dean of the Harvard School of Public Health, former Minister of Health for Mexico and author of leading analyses of global health and global health systems, kicked off a panel that included scholars from China, Ethiopia, Brazil, and right here in Canada to discuss what an ideal health care system might look like. Health system, it's not just healthcare, with a particular emphasis on the integration of public health and primary care. And finally, let me share with you, if you haven't already heard from some of the tweets that came out of the day yesterday, what Paul Dalalana, the founder of the founding endowment of our school, shared with us that morning. His decision the day before with Alessandra to double their endowment gift to the School of Public Health. That is amazing news. We all need to celebrate. Today we're going to hear from clusters 3 and 4. And this morning we'll ask, when is more when it comes to urbanism, health, and the incredible growth of megacities happening all over the world, including right here in Toronto? As more and more of the world's population migrate to cities to seek employment, for example, public health professionals must be thinking about ways to ensure that those cities provide healthy environments in large numbers. There's only a year and a half ago that China announced, for instance, that they were going to move an additional 120 million people into cities in 10 years. We have an opportunity to work with our colleagues across all sectors to design what those cities would look like in terms of not only the health systems, but the built environments, the information systems, transportation, because they all have such huge implications for what health will be like. Toronto is home to the Healthier Cities movement, which originated right here in 1984 and has gone on to involve in some progressive cities every sector of society. In that spirit, we've brought together experts from diverse fields, including architecture, business, medicine, engineering, information, and public health, to explore ways to design and build and change cities to provide our residents with the most equitable opportunities for health. A healthy city is one that promotes health equity for all citizens, and building healthier cities and communities is not only one of the Dalhousie Schools of Public Health strategic themes, it's also an area of focus for the entire university, including our president, Mayor Gertler, a fantastic urban scholar. Professors Blake Poland and Patricia Ocampo are leading the Healthier Cities and Communities Hub in the Dalhousie School of Public Health, and they'll be moderating the discussion this morning. And I'm so happy to also share with you that just last week, their hub won a Community Development Prize. And we are getting ready to launch one of their first seed funding initiatives, now with matching funds from the Wellesley Institute and the City of Toronto. Fantastic. I'd also like to thank two of our key vectors here for Cluster 3, Professor Sandor Galea, the Gelman Professor and Chair of the Department of Epidemiology at the Columbia Mailman School of Public Health, and Jeb Bergman, an urban sustainability and climate change mitigation pioneer who helped found the International Coalition for Local Environmental Initiatives, ICLEI. Sort of sounds like IGGY, ICLEI. I like that. Local Governments for Sustainability. This afternoon is our Achieving Convergence cluster, where we will ask, what kind of life should future generations experience? An ambitious question. Why are we asking that? Well, we happen to have here the lead author of the widely read 2013 article, Global Health 2013, The Grand Convergence in The Lancet. The article revisited the case for investments in health and developed a new investment framework to achieve dramatic health gains by 2035. Dean Jemison and colleagues wrote, a unique characteristic of our generation is that collectively we have the financial and the ever-improving technical capacity to reduce infectious, child, and maternal mortality rates to low levels universally by 2035 to achieve a, quote, grand convergence, unquote, in health. With enhanced investments to scale up health technologies and systems, these rates in most low-income and middle-income countries would fall to those presently seen in the best-performing middle-income countries. We're very fortunate to have Dean Jemison here to discuss that report, and many faculty to debate that report and what it means, including Srinath Reddy, the president of the Public Health Foundation of India, one of the great scholars of health systems, cardiovascular epidemiology in the world. I'd also like to recognize a few of our leading scholars who are central to the convergence discussion. Zulfikar Bhutta, of course, our maternal and child health expert, and one of the leaders of global child health at Sick Kids Hospital. Abdullah Dar, one of our co-chairs. Afir Ginsberg, the cancer expert. Dan Sellen, our new Associate Dean for Research, and Arjuman Siddiqui, one of our great social epidemiology experts at the Dalhousie School. Thank you all for your inspiring ideas that challenge us to think about health and health determinants in a unique way. Before we kick things off with our first cluster, I must remind everyone of a few housekeeping items. Number one, the bathrooms. Out the main door, past the coat check on the right. There are also additional bathrooms on the ground floor just behind the escalator and elevators. We'll be providing coffee, tea, juice, and snacks throughout the day, but we're not providing lunch. Just outside the doors is the Mars food court, past the bathrooms. And there are more options at the Toronto General Hospital food court just down the hall. And across the street is another food court in the Hydro building. That's across University Avenue. We also invite you to scroll graffiti on our graffiti boards outside, where we can capture anonymously, if you'd like, some of the most radical ideas you might have, because we want to embrace all of them. We have to think creatively, spanning disciplines, and perhaps those we haven't even thought of. I also invite you to use the hashtag GlobalHealthTO to tweet, and your tweets will find their way up there on the board. Finally, I also invite you to check out the digital student posters, which are located outside of the auditorium near the registration desk. We're going to have another great day. Thanks for joining us. And please keep clapping, because you are about to greet Patricia Ocampo, one of our professors, epidemiology, social and behavioral health sciences, and a co-leader of our Healthier Cities movement. Please welcome Patricia.
Good morning. Thank you, Howard, for introducing the cluster and also is this the first slide? Okay, we're going to go with this one. So we're going to introduce a new tool today. The tool is called Poll Everywhere. It gives you an opportunity to kind of weigh in on key questions that we're actually posing throughout the summit. We wanted to introduce it yesterday, but didn't get a chance. So today it will be used quite a bit. So let me explain to you how it works. There will be a question that will be posed. So for example, the first question is, it is often the experts who determine what about cities to monitor. What do you think cities should monitor to reduce health and social inequalities? So you have an opportunity to respond to this question now and watch the responses unfold. And there's a couple of ways to do it. First, you can you can send a message to 37607. See, does this have a pointer? Anyway, 37607. And then text the number 314814 with the space and your answer. So let's say your answer was poverty. So you would send a message to 37607, then type in 314814 space poverty, and then your answer will appear. You can also submit your responses to the pollev.com site, which is on there. And you can download the app. So the instructions are there. So I'm hoping that in the next few minutes or so, you'll log on and give your response to this particular answer. It's important to do because actually for the first half of this morning, the key star speakers or the key star participants are actually you. So this morning, the first half before the break is all about getting your input about what we should measure for cities. Let's see. Oh, there we go. So Dr. Hu mentioned the hub and our award. I just wanted to acknowledge the co-lead, my co-lead Blake, who's going to be running this resilience session after the break this morning. So I also wanted to let you know that one of our next activities of the hub is the seed grant call, which Howard mentioned, and there's going to be some flyers letting you know when and where there's going to be an informational session about the seed grant so that you can find out more information about how to apply. Okay, so let's get started then. I just want to give a brief overview about what should cities measure to capture progress in reducing inequities. I want to contextualize it by noting, as has been noted yesterday, that inequalities globally are on the rise. This slide here shows how inequalities have been rising across various countries. So the countries that are depicted in orange and brown have seen increases in on the order of 10 to greater than 20% in levels of income inequality in those countries. So the dark orange areas have experienced greater than a 20% increase in inequality since 2008. We also see some other statistics, for example, the rise in the number of billionaires, which is shown at the top of the circles in each country. Now, inequalities are definitely bad for population health. There are a number of consequences of living in a country or a city with high levels of inequalities. So those individuals who live in areas of high inequality compared to low inequality experience shorter lives, higher rates of imprisonment and higher crime, children who do worse in school, more mental illness, more housing insecurity in the population, greater food insecurity and obesity, more long-term poverty, poverty that's intractable, and more precarious jobs, jobs that are unstable and don't really lead to long-term benefits. And the list can go on and on. There's been documentation of this growing inequality, the trend in growing inequality, both in all countries, but also within cities. There's an increasing number of reports and conferences which are addressing this issue of inequalities in cities, starting with the WHO report in 2010 on hidden cities, followed by conferences and more recent reports on solutions, what we should do to address inequities. One of the themes that keeps reoccurring in these reports is that we need to have good governance, which is not surprising, but the governance needs to include a diversity of perspectives in planning. That's been mentioned as something that is very key, which is too infrequently not done. As mentioned by Richard Sennett in the 2011 conference on cities and health, he notes that a healthy city can embrace and make productive use of differences of class and of ethnicity and lifestyle it contains, while a sick city cannot. A sick city, on the other hand, isolates and segregates the difference instead of drawing collective strength from the mixture of different people. So this is a key idea. Unfortunately, when we look, for example, at urban observatories, which are trying to document the status of cities, we often don't see this perspective represented. We often don't see diverse perspectives represented in the kind of indicators that are suggested to be measured about cities. And so again, as noted in these conferences and reports, there's a growing recognition that just expert-led regulation and management of urban space has been problematic because health planning responses have in some instances had profoundly negative consequences for cities in the past. For example, growing inequalities. Instead, we should really make sure that planning efforts include a diversity of opinion. Urban citizens who are not doing what they're supposed to do makes for an interesting and good city because it enables people to create and nurture their homes and their own environments. So it's really key to include a diversity of opinions. What I thought I would do, just very briefly, is to try and capture some of those diverse voices about what should be measured in cities or what some of the problems are. And we did this through Photo Voice. So Photo Voice is sort of a research and social action tool for communities to come together and document issues that are going on in their communities. And we did a quick survey of some available photo voices to try and capture what's important to them about their neighborhoods and their residences and their cities. And we were hoping that this might inspire a discussion about how we can make sure that a diverse perspective is represented when we think about measurement and metrics. We actually found these photo voices through doing systematic searches on the web and in the literature and identified really just a handful because we don't have a lot of time. The first one that I'll start with is happening here in Toronto, in the west part of Toronto in the Black Creek neighborhood. This photo voice is representing the perceptions of residents of what it's like to live in be a person of color who's living in a low-income community. And there were several themes that were important to this photo voice, and I'm going to highlight a couple of them. One of them was housing and the state of housing, and in this case, housing disrepair. And so residents felt like They really wanted their concerns about their housing problems listened to. They felt that that the Toronto Community Housing should be really listening to what needed repair, and they would like better attendance to the issues that they raise. And they really felt like if their building was better maintained and safer, that all the residents would have better investment in the housing itself. And so we might think about measuring the availability of clean, well-maintained, affordable housing, and also spaces that create a sense of home and hope. The residents of this community were also very concerned about the negative images that their particular neighborhood receives, and they wanted to show that there are strengths in their neighborhood. One particular theme was about the availability of public spaces. So here they talked about public spaces being available in health centers, in community centers, in boys and girls clubs, and also at the mall. So really measuring accessible community space would be something important to consider. Also, it was important for this community to document what their own responses are to inequalities and experiencing injustices. So they really wanted to document their own responses, which represented strength and resilience. What was important to them was thinking about political engagement, advocacy, and then thriving grassroots movements who could really mobilize for change. Another photo voice that we encountered was from South Africa, from an informal settlement in South Africa. And here there were a diversity of perspectives that were represented as well, and we can only highlight a couple. One of them was really about the local businesses that were going on, the very small businesses that were going on in this informal settlement. They represented not only sources of strength, but sources of employment. Some of the local businesses and small businesses employed local individuals. And it was not only a source of money, but it was also resources and services that were available in the neighborhood. And they really contrasted these sort of small businesses with other employment opportunities that are often available, which are kind of dead-end jobs or contract work. So this was really a source of strength in this particular informal settlement. Another theme was infrastructure. And so there was a lot of disappointment that the municipality could not maintain good infrastructure, in this case, good walkways. This woman is walking along a pathway which is covered in sewage waste, and it's slippery, and she could fall with the baby on her back, and they viewed that as being dangerous. So really, infrastructure that makes neighborhoods walkable and livable was important for them. Another issue related to safety in other environments was about children's safety. So this was from the Safe Kids, where they're monitoring the walkable space for children and how safe it is, and also using this information to advocate for change. So here we see some before and after photos in India and in Vietnam of places that were not safe for children to walk, and they were able to advocate for change and what it looked like after. Another issue related to safety is about sexual harassment of women. Women are taking it upon themselves to begin to document their experiences of sexual harassment and mapping it. So here we have two examples from Egypt and from India, where women are actually mapping experiences of sexual harassment of all types. And so it would be important to think about measuring where it is safe for women to be in public spaces. We often think of Sweden as a place of relative equality, and it is, and we often hold it up as a model. Unfortunately, they too experience inequality, and this photo voice comes from youth who are in Sweden, and they were having difficulty with education and schooling. And so for them, they wanted to document some of the things that were important to them when they were attending school. And one of them was supportive teachers. They felt that what would keep them in school were supportive teachers. These individuals were in low-income communities and were finding that they were struggling, but if they had supportive teachers, they would be more likely to stay engaged with school and stay in school. Also, they were experiencing poverty and hunger, and this is a picture of their canteen. And although breakfast is provided, they were feeling hungry all the time, and so they wanted to document that as well. So it would be important perhaps to document social support networks, students' access to food, and then healthy schools in general. Finally, I'd like to just mention another photo voice that comes from Toronto, and it's about a living or a minimum wage campaign, making sure that everybody has access to a living wage. So this is documenting 1 million reasons why there should be a living wage or a minimum wage. And these are just some photos that were contributed to this particular effort, which is being hosted by Access Alliance. So here she's saying, poverty is bad for everybody. It crushes the human spirit. So hopefully that gives you some idea of how we might think about alternative measures of cities. And let's see, yes, people are weighing in. Thank you very much. And so I guess, are we going to keep this up? I think we're going to keep it up, at least for part of the time, so we can see what your answers are to what should be measured. Precarious employment, childhood poverty, noise, chronic disease, transit access. Thank you so much. So let me tell you what's going to happen now. We're actually going to break out into 4 sessions. As I mentioned, it's your turn this morning to weigh in on what should be measured. We actually have 4 sessions, 4 breakout sessions. Can the leaders of the sessions raise their hands? Great. So we've got Greg, we've got Jillian, Patricia, Jim, and Dan is somewhere. There he is, Dan. And maybe I can ask each leader to say just a couple of words about, I think you want to say metrics and what your session is going to be so that you can choose about where you're going. And so we're going to be in our sessions for about 1 hour and 5 minutes till 10:40, till the break. And we'll try and figure out a way to kind of summarize what each group came up with and maybe either put it on the graffiti wall or put it up somewhere so that you can see. And we'll also be able to summarize this at the closing session tomorrow. So who wants to go first? How about Greg? Do you want to go first? And can you say where your room is? Your room is going to be upstairs. CR3. Yeah.
Well, thank you. Let me bring a slightly different perspective going from the micro to the macro. We're going to talk about metrics. People often yawn, they sigh, metrics, numbers. I'm an engineer, I love numbers, but many people I appreciate don't. Often when people think of a process of leading people through change, measurement comes at the end. We have the dream, we have the design, we have the doing, the implementation, then we do the assessment at the end. What we're going to work through on the workshop is how you can use metrics as an important part of the initial visioning process. How you can use metrics to guide people through change. How you can use metrics to be a measure of success so that you know what success looks like when you get there. The focus will be on air pollution because air pollution is the #1 environmental determinant in growing megacities. What we're going to do is not actually talk about air pollution. So if you don't know anything about air pollution, that's just fine. We'll not measure pollutants or anything like that. We're going to use it as a surrogate because it is in and of itself a metric of the shared values in a city. It's a representation of how we separate as a population between our individual and collective values of well-being. We're going to look at, I'm going to ask you to visualize a megacity, how it grows, how it evolves, how determinants affect that. You're going to identify metrics to guide that change. Then we're going to put those metrics into a concept map to put it in context and represent how the interplay works. And if there's time, we'll see, ask you to identify a couple bits of low-hanging fruit, first possible changes. So that's what we're going to try to do within an hour. I'll be up in room CR3 with Ray. Where's Ray? Ray's going to be co-facilitating with me, and we're really curious as to where this is going to take us. Thank you.
Good morning. I'm Patricia McCarney. I'm the director of the Global Cities Institute here at the University of Toronto. So our session, we'll be talking about metrics and the standardization of city metrics in particular. As many of you know who work in this field and do research on cities, there's very little good quality data at the city level. Much of it's generated by national statistical organizations, or declining in our case in Canada with the long form census. I saw the blog go up. So we've been working since 2008 to build city level data. It's been 8 years of quite grueling work. We now have a network of 255 cities globally across 82 countries that are reporting on a standardized set of indicators for cities. I'll be introducing the session this morning with what has just happened. We built actually the first ISO standard on city metrics. So we took it to Geneva to the ISO in 2012, this set of metrics that we were testing with our 255 cities globally across Asia, Africa, Latin America, North America, and Europe. Because we'd already tested it, they put us on a fast track, and we'd already drafted definitions and methodologies and standardized ways of measuring. So we now have an ISO standard. So we'll be talking about that. It's ISO 37120. It's the first ever standard from ISO on city data. So we're very proud to have this published, and we're now implementing it with 20 foundation cities across the globe, which we'll be launching in 2 weeks in London at City Hall with Boris Johnson hosting. So we're going to talk about standardization, how to get to city metrics, and what body of the subset of those 100 metrics that we've been building could help to facilitate a health index for cities. So that's where we're moving, and I'm very proud to have Gillian Booth with us this morning, who is also helping us to facilitate this workshop. Gillian does remarkable work on, especially the one I know, around diabetes and walkability in cities. We'll talk about PM10 and PM2.5, which is part of this ISO standard. We'll talk about green space and housing and all the kinds of things that Pat was just introducing as things that really do need to be measured. So this is a broad sweep of indicators that we're going to talk about. And because we're positioned in the ISO now, we have ISO 37121. They've already given us a number, which is a new standard that we're building on resilience in cities. So our workshop will talk about resilience and which indicators, and that's why this workshop is so useful for us at this point in time, because we can actually feed in indicators and priority indicators that you think should be prioritized for this new standard on ISO 37121 on cities and resilience. So we'll be talking about building the new standard, and your input would be highly valuable. The next meeting is in January. I chair the committee in the ISO on city indicators. So your input would be very welcome in this workshop. Thank you.
So there'll be three sessions here. The wall is going to come through, and the Patricia session, Patricia and Gillian session will be in the middle. Dan, do you want to talk about the
So I have the pleasure of co-facilitating with Pat Ocampo, and I think we are going to be over here. And our session is going to focus on violence. And we're going to look at violence through the lens primarily of drug policy and drug-related violence. So just to give a brief overview, we're in a period where our policies around illegal drugs are in a massive state of transition, mostly internationally, but also in North America. And what's that entailed is a shifting primarily of the kinds of outcomes and metrics that we're measuring. So for instance, you look at Colorado, which recently decriminalized and regulated the sale of marijuana. What they're talking about now primarily is not the number of people who are imprisoned for marijuana offenses, but rather the amount of taxation that they're generating from marijuana sales. Now, when it comes to drug policy, one of the issues is that it has so many distal outcomes, and certainly violence is one of them. And the question that we want to pose is, how do you adapt metrics for distal outcomes. And we're going to use, again, the lens of drug policy and violence. And we're going to look specifically at Toronto, where there is an ongoing high level, particularly, for Canada, high level of homicides and gun violence that are related to drug-related gangs and the ongoing recruitment of young people into drug gangs. But so far, there isn't seemingly a sense in the public discourse around this issue of the connection between a drug policy that creates an illegal drug market and the kind of violence that then entails from that scenario. So the major questions we're going to look at are, how to adapt metrics for distal outcomes of policies. Secondly, how to adapt those outcomes or the metrics that we're using for local settings, and in particular, Toronto in this case. And finally, how do you create and agree on a set of metrics when we're talking about highly controversial issues that not everybody agrees on? So we'll be over there.
All right, I'm going to be leading a group in Auditorium C, which I'm over here to my right. And we're going to be talking about a set of metrics that really appeal to the visual. And I think you got a bit of a taste of that actually with photo voice. So it sort of shares some relationships with that. But essentially what it's going to be doing is talking about street level imaging, which is produced in things like Google Street View. And I'm going to talk about some technology that I've now got available in my research lab, which is essentially the same technology that Google uses to collect all those street level images. And so we're collecting our own and building a database over time of those street level images. And we're going to talk about coding that. So it's a set of methods called video systematic social observation. And there'll be a couple of demonstrations of it. So we'll demonstrate it for physical and social disorder in neighborhoods, the visual cues of physical and social disorder. And we'll also demonstrate it for the visual cues that make everyday streetscapes aesthetically pleasing for physical activity. And so we'll walk through the technology, we'll talk a little bit about the ethics of it, which have been interesting to say the least, and also some of the possibilities of it for the future. So without any further ado, I'll pass it on to the next person.
Okay, so I know you have a difficult choice to make. You have violence, you have ISO standards and metrics, and you have visual metrics in A, B, and C. And again, this wall is going to go up. And then upstairs, you have clean air and concept mapping. So I think what's going to happen is there's going to be like a minute or so of rearranging the room. But if you're wanting to go upstairs, I think it's just one floor up. Is that right? Okay, and we'll see you after the break to talk about resilience. Have fun.
So